This is another presentation by My Weight World. Eating for a Healthy Heart. Part 1. Why Healthy Eating Matters. An essential part of keeping healthy is taking great care of our heart. Information from our healthcare providers and other sources abound, but it is always great to be reminded of ways to be kind to this very vital organ. And the things you do to take care of your heart will also be great for the rest of your body too, especially your kidneys, liver, and brain. When it comes to heart-healthy eating, it is important to keep our goals in mind and discuss them with your healthcare provider. Know your numbers, including your total, good and bad cholesterol levels, your blood pressure, blood sugar, and as uncomfortable as it might be, weighing in at your doctor visits are an essential part of health checks. Eating for heart health includes using foods that protect us, healthy fat sources, minimizing the damaging, dangerous fats in our diet that are quite abundant in typical American foods, and increasing protective nutrients such as fibers, which not only keep our heart healthy, but provide great protection for our digestive tract as well. Fiber intake is like a workout for our intestinal tract. Lower incidence of heart disease is associated with a high intake of fruits and vegetables, not only because of their low calorie and high fiber content, but because of the numerous healthful substances they contain, mostly known as phytochemicals and antioxidants, which protect the interior vessel walls from injury and inflammation. Exercise also helps our heart by keeping our weight down and our blood vessels flexible, more resistant to blood pressure problems. Minimizing salt also helps our heart and kidneys by protecting these vital organs from the stresses of fluid overload, which aggravates blood pressure problems. The process of atherosclerosis blockage of arteries takes place over time. The presence of risk factors may accelerate the formation, progression of atherosclerosis plaques. Normal blood vessel. This is how an artery should look in a healthy individual. Buildup of fatty streaks. When blood cholesterol levels are elevated, cholesterol may begin to deposit inside the arteries to form a plaque. Plaque is made of fatty substances, cholesterol, calcium, and other cellular debris. This process can begin at the age of 10. Blood vessel with atherosclerosis. As more cholesterol attaches, the plaque gets larger. There may be no pain or warning symptoms to indicate that this is occurring. Advanced atherosclerosis. As the plaque builds up, blood flow through the artery becomes restricted and could cause heart disease. The plaque in the arteries may become large enough to completely block the inside of the artery. If the plaque ruptures, a blood clot may form to also completely block the artery. When the plaque gets large enough to block the artery, oxygenated blood cannot pass. Warning signs such as angina, chest pain, heart attack, or stroke may occur. One type of fat in the blood is known as LDL, or low-density lipoprotein. This type of cholesterol is known to promote dangerous blockage of blood vessels and is associated with a higher risk of heart attack or stroke. Additionally, with the diagnosis of diabetes, LDL particles may be even more dangerous because of their smaller size and more harmful effects. So when you may be advised to aggressively control your cholesterol levels by diet and/or medications, the LDL is usually a primary factor that your healthcare provider is looking at. Cholesterol and other fats cannot dissolve in the blood. They have to be transported to and from the cells by special carriers of lipids and proteins called lipoproteins. There are several kinds, but the ones to be most concerned about are low-density lipoproteins. Remember, LDL is the lousy cholesterol. Low-density lipoproteins are the major carriers of cholesterol in the blood. They transport cholesterol from the liver to the cells. When a person has too much LDL cholesterol circulating in the blood, it can contribute to the accumulation of plaque within the walls of the arteries in the heart and elsewhere in the body. A high level of LDL cholesterol reflects an increased risk of heart disease. As a result, LDL cholesterol is often referred to as the bad cholesterol. Benefits of lowering the LDL include a significantly decreased risk of heart attack or stroke, reduced formation of new plaque, and even possibly reducing existing plaque. Also, this reduces the possibility of the rupture of plaque, which causes blockage in a blood vessel leading to a heart attack or stroke. Heart attacks and stroke not only kill, but cause major disability and decreased quality of life in people of all ages. To minimize the dietary effects of foods on raising LDL levels, reducing intake of dangerous fats, such as saturated and trans fat sources, are of utmost importance. Additionally, using foods that can help us eliminate excess cholesterol through our digestive tract can also be helpful. Plant foods have two main types of fiber, soluble and insoluble, which are great for our gut, but the soluble fibers are the most beneficial for lowering our blood cholesterol levels. HDL, or high-density lipoprotein, is the type of blood cholesterol that is actually protective. This keeps our arteries clear and removes the damaging effects of cholesterol in the blood. Think of HDL as happy cholesterol, to remember this as the beneficial type. HDL carries cholesterol from the cells to the liver for excretion and reprocessing. The HDL particles are like receptacles, or a shovel for cholesterol. It takes up extra cholesterol from tissues and prevents the buildup of cholesterol in the arteries. A high level of HDL seems to protect against heart attack. That is why it is often referred to as the good cholesterol. Smoking and being overweight can cause low HDL levels. Exercise helps to increase HDL levels. There is a direct relationship between weight loss and the rise in HDL. HDL levels are lower in smokers than non-smokers. HDL levels normalize within 1 to 2 months after smoking cessation. Of course, along with other numerous benefits of giving up this dangerous habit. Triglycerides are the chemical form in which most fat exists in food as well as in the body. They are also present in blood plasma, the liquid surrounding blood cells, and, in association with cholesterol, form blood lipids. Often in diabetes or other pancreatic disease, we may see very elevated triglyceride levels. Alcohol intake may especially aggravate triglycerides, so it is important to discuss with your doctor whether alcohol intake is right for you. Triglycerides in blood are derived from fats eaten or made in the body from other energy sources, such as carbohydrates. Fats eaten in a meal and not immediately used by tissues, that is, not converted to cholesterol and transported to the tissues by lipoproteins, are converted to triglycerides from fat tissue, so they meet the body's needs for energy between meals. When triglycerides are released from fat cells, they are transported to the liver, where they are converted to LDL cholesterol. Triglyceride levels may be abnormal if you have not fasted for 12 hours prior to a blood test for lipid levels. While you are allowed to consume water, you should not consume alcohol for at least 24 hours prior to the blood test. Obesity, especially upper body fat, is a dangerous risk factor for heart disease, the #1 killer in the U.S. When even 7% of one's body weight is reduced, we can often see excellent improvements in heart disease risk factors, and many of these risk factors, including elevated cholesterol, triglycerides, and blood pressure, are silent and damaging to your entire body, from your head to your toes. So to start monitoring your progress toward heart health, look not only on the scale, but get out a simple measuring tape and see how your waistline is changing as you make your efforts towards weight control. As a very prominent and respected diabetes doctor mentioned recently, Waistline measurement should be part of everyone's health checks at every visit, because of this measurement's significance in heart attack risk. Along with weight, make sure to know your numbers. Keep track of your lab work. Discuss your numbers including blood pressure, blood cholesterol, and other measurements with your doctor at each visit, and know your trends. Which way are these measurements going? Be aware of family history of heart disease or stroke, as well as diabetes and blood pressure. Prediabetes, formerly called borderline diabetes, is also a very significant risk factor for heart disease, and is more often than not silent until damage to blood vessels are already present. Good communication is key. Consider making notes and writing down questions before your doctor visits to ensure that you have learned all you need to know about taking great care of your heart. In Part 2, we will be reviewing more details about heart health. In Part 2, we will be reviewing more details about heart-healthy foods. In summary, we know that heart disease is a leading cause of death and disability in the U.S. Knowing your risk factors for heart disease and how to minimize them is one of the best ways to take care of yourself and add quality years to your life. This has been another presentation by My Weight World.